Hello, Assalamu alaikum. Now I'm starting with another important topic in the subject of forensic medicine, and that is traumatology. That is the study of trauma. What are various mechanics? What are various classifications? And what are various causative factors who cause the change in appearance of the wound? So in this lecture, which is the first lecture, I will be discussing what is the meaning of trauma and traumatology. What are the difference in the words wound, injury, and hurt? Then what were previously laws about grievous hurts? And now the prevalent law in our country, Pakistan, is the Causative law. So what is the definition of hurt in Causative law? Then I will discuss in this lecture various classification of injuries. We can classify in various manners. That means we can classify anatomically, anatomical appearance. That means closed wound, open wound. Then other classification, that is the medico-legal classification. On the manner of infliction, then on the manner of causative agent. So there are various bases of classification of mechanical injuries. So starting with the first lecture, Bismillahirrahmanirrahim. Traumatology. It is also called as mechanical injuries because to cause an injury, certain mechanics are involved. So that's why they are called as mechanical injuries also. So traumatology by word, as being the science student, we know what is logi, that is the study of the science. So trauma is the physical or structural damage on the body by some force or energy, and it also includes mental and emotional stress leading to some disorder or any insult. And logi is the study. So in simple words, it is the study of injuries. So traumatology in science is the science which deals with the study of physical or structural damage on the human body as a result of application of physical force. So various words which are synonymously and they have different meaning: injury, wound, and hurt. So they should be clearly understood what the meaning they convey. Injury, any break in the body tissue externally or internally, is termed as injury or wound, having the same meaning and having same pathological entity. Whereas in Pakistan Penal Code, which is the law, in that law, the injury denotes any harm caused illegally to any person in body, mind, repute, and property. And wound is a medical term and it is not defined by law. So wound medically is a breach in the integrity of the tissue. So injury has been replaced by hurt under Causative Ordinance and now the law in 1991. which introduced a new classification of hurt or injury, giving more clear and elaborate compensation for the physical suffering due to criminal hurt for the first time. They are in legal terms and to give the punishment to the culprit and compensation to the sufferer. So these are more now elaborative terms under the Qisas and Diyat law. Injuries have been recognized and declared in legal terms according to the provisions of the law. And the legal definitions are comprehensive and cannot be changed. So they should be reproduced without alteration. Sometimes an injury may be insignificant in the eyes of the law, but it may prove fatal and cause death in medical views, like bruise. Apparently, it looks a very trivial injury, but if they are extensive and the bleeding underneath is sufficient to cause the hypovolemia or other complications, so then bruise can be a fatal injury. So in Pakistan Penal Code, injury is defined under section 319 PPC, Pakistan Penal Code PPC. And section 320 PPC classifies some grievous hurts. You can see the grievous hurts that they are grouped together, but they have got various different amounts of the trauma. But sections 319 and 320 are now replaced by Qisas and Diyat law. And now they comes under the section 320 of Qisas and Diyat Act, in which there is not only punishment but compensation also. So grievous hurts which were previously used under section 320 PPC, the grievous hurts were emasculation, loss of eye, loss of ear, permanent impairment of joint, permanent disfigurement, fracture of a tooth, or any hurt which endangers life or causes impairment of normal pursuits for 21 days. So you can see loss of tooth and loss of eye is the same grievous hurt. Similarly, permanent disfigurement or emasculation, they are all classified under grievous hurts which were previously used. But in Pakistan now, the Qisas and Diyat Act is now prevalent and the injuries are defined in a more elaborative manner and compensation is awarded. So the hurt, according to Qisas and Diyat law, hurt means causing pain, harm, disease, infirmity, injury, or impairing, disabling, dismembering any organ of the body or part thereof without causing death. That is called hurt under Qisas and Diyat law. You can see it covers all aspects of the trauma. So now starting the discussion of classification of injuries. First is the anatomical classification. We can classify anatomically, and that means the closed wounds or open wounds. And this is basically structural appearance, that is closed or open. And burns are also classed in a separate group. Then the closed wounds, they are abrasions or contusion and bruises. And the open wounds are lacerated, incised, penetrating, stab or punctured wounds, firearm injuries, and blast injuries. So they are grouped in open wounds. Then the burns may be dry flame burn, wet burn means with fluids, sunburn, corrosives, electrical burns, lightning, and X-ray radiation burns. Then the medical legal classification, they are grouped as mechanical injuries, thermal injuries, chemical injuries, electrical injuries. And on the manner of infliction, they are suicidal, homicidal, or accidental. Then on the basis of the causative agent, the agent or weapon instrument can be sharp-edged, blunt, then firearms are separate because this is a special trauma, and fire, which causes burns, electrical, chemical, radiation. So these are various classification according to the causative agent. The summary of this first lecture is that we have learned the meaning of traumatology. We have understood what is the difference between injury, wound, and hurt. And we have also learned what were previously terms used as grievous hurts and the definition of hurt in Qisas and Diyat ordinance. Then we have learned the classification of injuries, which is anatomical classification, medical legal classification, on manner of infliction, or on the basis of causative agent. So thank you very much. This is all for the first lecture on the traumatology, and we'll continue the discussion in the next lecture, inshallah. Take care. Allah Hafiz.